Hi, I'm Dr. Lisa Casey. I am the Program Director for the new Family Medicine Residency program at Tammany Health System. I know that this program will give you the best training in both the inpatient and outpatient setting, and we'll do it in a state-of-the-art hospital and a brand new family medicine clinic.
Tammany Health System has a very robust strategic planning process. And about 5 years ago, we really embarked on the journey to become a family medicine graduate medical education site. We're very fortunate that our partner, Ochsner Health, has served as the sponsoring institution for this amazing program.
I think the residency partnering with Ochsner Health has the benefit of having an established organization with over 30 specialties, including subspecialties, sim lab, and just a very big geographic pool for patients for diverse education.
There are no other residents in the hospital. This will be the sole focus of our hospital, so family medicine residents are going to be unopposed, and you are going to have your first chance opportunity on every patient case, every procedure that you want to fulfill your own needs, your own goals, and the skills that you want to obtain during your training.
That we have a lot to offer here at St. Tammany. It's a unique and special community. It's a very successful hospital that is totally committed to training the future generation of physicians through our family medicine residency. We have a committed and very expert medical faculty that's excited and eager about the opportunity to teach and provide training for the future generation of residents, and full commitment on the part of the executive team and the board to making this a successful venture.
I'm passionate about family medicine. I'm passionate about teaching residents. They share my passion for this. It's where we find our purpose, and it's passion and purpose that we hope to instill in you.
One of the things I love about family medicine is that I can practice as broadly or as narrowly as I want. There's so many different opportunities and the opportunity to change what I want to do throughout my career.
Some of my favorite things are continuity of care, so being able to take care of a patient and really build that patient-physician relationship in a meaningful way. I also love being able to take care of multi-generations.
I want to help train great physicians to help take care of our community.
Both residents and medical students give you a nice, fresh perspective, I think, on pretty much everything.
I actually wanted to become a faculty physician after I started teaching medical students. It energized me and made me excited to teach, and so I wanted to do that in a more impactful and complete way.
We're teaching each other. A lot of times I learn from my students just as much as they learn from me.
I'm excited about building relationships with you. In near 27 years of practice, I've treated over 100,000 patients. I've cherished the relationships with the patients, but I also cherish the relationships with Lisa Casey, Catherine Pichon, and Gabby Gibbons. What a rock star faculty that I'm privileged to be a part of.
Tammany Health System is an amazing academic environment. And I say that because while we are exploring GME for the very first time with emphasis on family medicine, our team here of 2,600 colleagues and over 600 medical staff leaders have really come together to create a high-performing environment that strives for that journey to high reliability.
We've developed a pretty sophisticated healthcare delivery system with the ability to offer a lot of services that are really beyond what a usual community hospital is able to offer.
We have a plethora of medical conditions. Those things that you thought you'd never see when they told you in medical school, those don't exist anymore, they're here. You're going to get those complicated patients.
We have robotic surgery here, we have laparoscopic surgery, we have vaginal surgery, pretty much the whole gamut of GYN and GYN oncology.
So you'll have a really good breadth of the common stuff that you'll see, but like I said, we do get zebras that come through the door as well. And I think what's really unique about the family medicine residents training here is that they get the experience of taking care of pediatric ICU patients as well, which is very unusual.
One of the unique opportunities we have in starting a new program is the ability to innovate. I'm looking at places like lifestyle medicine, obesity medicine, community medicine, all opportunities we have to make a difference in our community and change outcomes for our patients.
We have a very special opportunity with a unique circumstance in that we have an outstanding community here on the North Shore of Lake Pontchartrain in St. Tammany Parish. And we have an outstanding hospital, St. Tammany Health System, that has grown up around serving the needs of this community.
There was just no other place that I could see myself working, and St. Tammany is actually a place where I personally received medical care, so I knew what wonderful and excellent medical care was practiced here, and so it filled me with joy to be able to come back home and practice in my own hometown.
St. Tammany is a great place for a family medicine residency because it's a great hospital. It's a great place to work.
From the scrub techs to the nurses to the anesthesia to the nurse anesthetist to the person cleaning the floor. I mean, everybody's pretty happy to be here.
I've been part of this organization for close to 20 years now. I've seen drastic changes for the positive within the health system and for the community as a whole. But as said by our boss, our CEO, Joan Kaufman, it's the culture that separates us here.
So St. Tammany is such a wonderful place to practice, and it's going to be a wonderful place to train as well. It's such a collegial and family-friendly atmosphere. Everybody truly treats you as family.
The nurses are happy here, the docs are happy here.
We feel very comfortable with each other. We're comfortable with our colleagues. It's a great environment to work. People come here and stay here, which says a lot.
What I love most about my hospital specifically is that we do have that collegiality, we do have that communication, and it helps provide better care. It also makes work a lot more fun.
Not only is St. Tammany a great place to work, the community is a great place to live. I raised my family here, the schools are great, it's safe, there's a lot of downtown activities.
Louisiana is known as the sportsman's paradise, so there's a lot of outdoor activities. I personally love to go jogging at the lakefront, biking on the St. Tammany Trace. I like walking my dogs at the lakefront. It really makes for an enjoyable atmosphere, and there's plenty to do. There's great food, great culture, great people. It's a wonderful place to live.
St. Tammany Health System has been on a trajectory for remarkable levels of success over the past few years. And this new phase of becoming a teaching hospital is really an exciting next step for us in terms of our continued evolution and ability to serve the community.
Our goal for the residents of this program is to develop a love of family medicine, a passion for treating patients, in addition to gaining the medical knowledge that it takes to be a great family medicine physician.
The biggest benefit to this program is you're gonna be able to participate in anything that you really want to participate in.
We want them to recognize a sick kid from a well kid, whether they're going to be in a hospital or working in the clinic, and I think they're going to be able to learn that skill here.
My goal for you when you graduate family medicine residency is that you have the confidence and competence to practice full-scope family medicine in however you choose to.
Because of the number of services offered here at St. Tammany, your training will be extensive. You'll be able to leave here as the best family practice physician you can be.
My goal for the residents that graduate our program are to be so well trained that I would feel comfortable sending my own family members to them.
If you have a love of family medicine and a pioneering spirit, join us.